Thumbs up. Good morning to everyone. We're so happy to see such a large turnout this morning. This is really going to be a treat for us. The committee has worked very, very hard in putting this thing together. And so, right off the bat, the first thing I want to do is introduce the committee members. So if all the committee members who are present, please stand up and be recognized. We want to appreciate you. We think we have a very wonderful program put on here today, and I think we're going to enjoy it. Hopefully it will be very informative, and hopefully we'll be able to move forward in some of the ideas that we will work on today, particularly in putting resources together, helping physicians steer patients in the right direction, and then secondarily making sure that mothers and babies are taken care of properly. So we'd also like to thank the sponsors. There's a sign up before you. There are Women's and Children's Hospital, Project Launch, The Knowledge Effect, Lafayette General Medical Center, The Extra Mile, and Martin Diamond. So again, we'd like to thank them. Thanks again. And housekeeping. If you don't know, right out the doors, a quick right and then a quick left, you get to the restrooms. The lunch will be provided, but if you have a need for a soft drink or something, there are vending machines that are available in the back. We should have lunch for you available at the lunch break. Snacks and coffee are also available in the back if you should need. The other thing is nurses who will be applying for CEUs. We asked Dr. Jennifer Lalonde to come in and explain to you what we'll do.
Sure. Good morning, everyone. We do have an additional sponsor that we would like to thank, and that's Dr. Gail Poirier, who is the Dean of the University of Louisiana at Lafayette College of Nursing and Allied Health Professions. She has graciously donated the CEUs for today's program. There's a couple of disclosures I need to make in reference to the CEUs, and first of all, this educational activity has no commercial support. The planners and presenters of this program have disclosed that they have no commercial support or conflict of interest related to this program. And for those nurses that are interested in obtaining CEUs, we're offering 3.75, and you need to attend both the morning and the afternoon sessions. You should have received a packet when you checked in. Please complete the CE Contact Hour form as well as the program evaluation. At the end of the program, you can turn both of those forms into me, and I will go ahead and give you your CE certificate. Your name is not on the CE certificate, so please remember to go ahead and write your name on it. For all other participants who are non-nursing, we do have a certificate of attendance to provide to you today. And again, I'd like to thank Dr. Gail Poirier at UL for providing the CEs for this program.
Thank you, Dr. Lalonde. So without further ado, we're going to get into the program. There's no way that I can justifiably introduce Dr. Lester in just 5 minutes, and we already passed that time. So briefly, I'll say that Dr. Lester is a professor of psychiatry and human behavior, professor of pediatrics, and a founding director of the Brown Centers at the Alfred Medical School and Women's and Infants Hospital of Rhode Island. The Center for Study of Children at Risk is a research center, and the Center for Children and Families provide diagnostic and treatment clinical services. Dr. Lester's research has been continuously funded by NIH for the past 31 years. He has conducted prospective longitudinal follow-up studies of children with prenatal cocaine exposure and children with prenatal methamphetamine exposure. He is currently conducting a longitudinal study of infants with neonatal absence syndrome. He has been heavily involved in the NIH peer review process, having served on numerous NIH study sessions, the NIH National Advisory Council on Drug Abuse, the steering committee of the National Advisory Council on Drug Abuse, the NIH Director's Pioneer Award Program, and the College of the Center for Scientific Review. He is past president of the International Association for Infant Mental Health and the author of more than 250 peer-reviewed publications and 18 edited volumes. I present to you Dr. Barry Lester.
Thank you, man. Good morning. I'm delighted to be here. Oh, I have to tell you, I have a cage, right? It's all marked out on the floor. Okay, so I have to stay within these boundaries. So if I step out, he's going to start yelling at me. Is it okay if I sneak over for a water every once in a while? Okay, thank you. I won't get shot or anything. Okay. Well, I'm really delighted to be here and delighted that you're putting on this event, and thrilled that I was asked to come and speak. I too want to thank the organizing committee and the sponsors, and particularly Dr. Brown for spending all day yesterday showing me around the city during his retirement, right? And you know, I really got a sense, I feel like I got a sense in a half a day of, you know, just getting a good feel for what the community was like. And we spent some time in the NICU and talking into the staff. And again, it was great because it kind of grounded me in terms of, you know, the kind of discussion we're going to be having today. So that was, whoever decision that was, I think it was yours, but it was a really good decision. I have to get the clicker. Okay. I'm going to be showing some PowerPoint, and then I'll be showing some video also to kind of go along with things. And I'll let you know when we get to each. I have no disclosures. I do have conflicts with my kids sometimes and my family sometimes, but that's probably not terribly relevant to this issue. These first set of slides, you know, back in the day, people didn't used to hand out the PowerPoints, right? So you'd be seeing these for the first time, so they're, you know, I think they're kind of funnier when you see them for the first time instead of having them all in advance. But what I like about these is they're really a kind of microcosm of the issues that we're going to be discussing today, and just bring out a lot of the complications in a different kind of way, in a cartoon kind of way, that really illustrate the complexity of the issues of dealing with children at risk. And, you know, one of the real take-home messages of this whole conversation is going to be just how complex this really is. Probably not something I really need to tell you, but when you know, it has so many arms and legs that sometimes you feel like it's just impossible to get a hand on. That wasn't intended as a pun, but it just came out that way. So, you know, this first slide, that, you know, given the right or wrong circumstances, any child can be at risk, and, you know, whenever oops, wrong. Here we go. I'll get this thing. Okay, so So whenever Mother's Day rolls around, I regret having eaten my young. You know, I guess there is a certain amount of guilt around this whole area. And then, of course, there are biological issues, and we will be talking about genetic factors which are starting to play more and more a role in this whole area. And then, of course, there are social factors. You know, your mother and I are feeling overwhelmed, so you're just going to have to bring yourself up. And, you know, again, what I really like about this stuff is some people would say, you know, that's not as funny as it sounds, right? And then the fact that children can be at different risk for different things, you know, they got extinct because they didn't listen to their mommies. What's instructive about that is when you say children can be at risk for different things, what that really brings up is, you know, we're so used to saying, oh, this kid is at risk. Well, at risk for what, right? At risk for severe impairment, at risk for cognitive problems, at risk for social emotional problems. Are we talking about, when you look at research, you know, research is based mostly on statistics. So it's very common in research to present your data and you say, oh, well, I find differences between this group, you know, the exposed group, and this group, the non-exposed group. The differences are statistically significant. Okay, but how does that translate into clinical practice? Meaning, are the differences clinically significant? And what kinds of differences are there? And it's very easy to slip into equating differences with deficits, or into equating differences with clinical deficits. Okay, so if I say to you that you know, cocaine-exposed babies have significantly lower IQ scores than non-cocaine-exposed babies. And if I just say that without explaining more, the implication would be that, oh, cocaine-exposed babies have cognitive deficits. Cocaine affects cognition, right? If I then say to you, well, yeah, but the differences are 4 points, and they're all within normal limits. It's the difference between a 92 and a 96, right? That, if I don't add that on, right, you're going to get a different very impression. Then I say, yeah, they're different, but the differences are within normal limits, and then you can ask the question, are these differences clinically significant? And that's a separate conversation. So it's really important to keep that in mind when we're evaluating research and trying to translate research into clinical practice. And of course, the same is going to pertain to the babies with NAS. I'm going to sneak over. This HBO show was made a number of years ago. It was done in collaboration with with NIDA, the National Institute on Drug Abuse. And the reason it was really made is because since the original, you know, so-called cocaine epidemic of the mid-1980s, you know, there's been a tremendous amount of research, neuroscience research in particular, showing that addiction is really not a matter of, you know, bad people, nasty people doing nasty things on purpose, mothers using drugs because they don't care about their baby, or they don't, but they even want to damage the baby, or, you know, how can they possibly do this to their unborn? What's wrong with them? You know, which really used to be the mode of thinking, and resulted in a lot of unfortunate social policy issues where many mothers were prosecuted, you know, for things like transmitting drugs to a minor, and you know, the rate of out-of-home placement was just skyrocketing. The number of children in foster care was skyrocketing, and what a lot of the research started to show, and this just gets confirmed more and more, you know, is the fact that addiction is really it's a mental disorder in some senses, unlike other mental disorders, and you know, we can talk about ways in which it's not unlike mental disorders, but it's a disease. It's a disease of the brain, and it is curable, and it's taken, you know, 20 years for the research to demonstrate that, and also for public opinion, let's say, and the scientific community, as well as the legal community, to understand that and kind of get their heads around it and understand that it has very different implications for social policy. So this HBO series was made in conjunction with NIDA to really try and convey this new information and this new understanding. It's, you know, we absolutely know that substance abuse, you know, it's an issue that's been with us forever, and you know, one of the reasons that it is different from other kinds of, you know, quote-unquote diseases is that, you know, its tentacles spread throughout a tremendous number of aspects of society. You know, it affects, you know, medical issues and social issues and economic issues, criminal justice, you know, which is why when you talk about over $300 billion a year. So, you know, if you have a heart disease and you don't take your medication, well, you know, you might be messing up your life, but, you know, you're not going to have this kind of overall impact. So that's certainly one way in which the addiction disease is different from other kinds of diseases. And the other thing is the reciprocity, the synergism, the complex interrelationships between mental disorders and addiction. They share so many features that you know, that you can see up here. You know, some aspects, and you know, you have the brain in the center here, but there's so many areas in which they have in common. So, you know, susceptibility to one increases susceptibility to the other. They're really comorbid. It's you know, more common than not to find mental health issues associated with substance abuse issues. So treatment programs, you know, that just treat the substance abuse and don't treat the mental health disorders are inadequate, to say the least. You know, you really have to take this on as a comprehensive set of services and you know, address the complexity and address the interplay of these two different kinds of systems, which are really one system in a sense. One of the other themes that you're going to see throughout this presentation is similar in the sense that, you know, women who use substances, whether it's, again, cocaine or methamphetamine or almost any substance, rarely use only one substance. You know, polydrug abuse, polysubstance abuse is really the norm. So when you start looking at that level of complexity, then, you know, we know that, so 11% of children live with at least one parent who's either alcoholic or in need of treatment for the abuse of illicit drugs. And again, putting this on the larger stage where we're not just talking about one particular substance. It's really polysubstance abuse. And then the ramifications that go even beyond that. So again, when we talk about this having a lot of tentacles and affecting different areas of society, so we know that substance abuse is a contributing factor in 40% of the 1.2 million cases per year of child abuse, and in 40 to 80% cases of families involved in the child welfare system. So that connection is very, very prominent, and the demands on the child welfare system as a result of prenatal drug exposure is tremendous, and you know, and obviously very, very costly. Years ago, what was it, in the, I think early 1990s, wasn't that early. The problem we had in Rhode Island, you know, Rhode Island is this, you know, little dinky state, you know, it's really small. I was telling Dr. Brown last night that if you drive 30 miles in any direction, you're in a different state, right? So